washed my hands with my stethoscope prior to this. So Olivia, my name is Charlotte. I'm going to be your nurse for the head-to-toe assessment. And it's just basically a general system so I can see how everything's working in your body. Do you have any questions before we start?
No.
Were you in an accident or anything that would make anything in your abdomen, legs, arms, either swollen or tender?
No.
No? Okay, perfect. Do you need to pee before we finish? Start?
I'm okay.
Okay. So first I'm just going to ask you a few questions. Do you know your name?
Yeah, Olivia.
Okay. Do you know where we are?
Yeah, Seneca College.
Okay. And it doesn't look like you're in any distress for breathing. You know where you are. Your gait and range of motion seemed okay when you came in. So yeah, I'm just going to start now with your head. I'm going to be inspecting for any lesions, physical deformities, any hygiene issues, swelling, lumps, and I don't see any. Your hair color is an ash blonde with good distribution. I'm going to palpate your head now. Okay, so you have good hygiene. I don't see any deformities, I don't see any masses, lesions, scarring, any lumps. Okay, good. Now I just have to see your face now. I'm going to inspect it for symmetry. Most of your features seem symmetrical with each other. I'm just going to feel here for tenderness. I don't feel any lesions around your face. Okay, I don't see any involuntary movements, no swelling, so that's good. So now before we go on to your eyes, I'm going to need to do a cranial nerve 7 test. And it's pretty much just to see how your facial structures work. So can you smile for me? Can you frown? Squint your eyes. Lift your eyebrows up. Good. And now pop out your cheeks. Good. Okay. So now I'm going to go on to your eyes. Your eyebrows are the same color as your hair. Sorry. Your lids are the same color as the rest of your skin, which matches your ethnic background. Your lashes are in great distribution and nice and voluminous. Your sclera and conjunctiva both are in good color, nice white. No crusting, no discharge coming from your eyes. Your veins are present and your eye color is blue. So now I'm going to do cranial nerve 3 test, and I'm going to test the size, the symmetry, and I'm going to see if the lighting in your eyes can constrict when needed to. Okay, consensual and direct lighting. Okay, so I'm just going to assess your pupil size right now. Looks to be between a 2 and a 3 millimeter to me. And now I'm going to do this, and I'm just going to see if your pupils constrict, okay? Good. Good, okay. Now you just follow my finger. Good, 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 good. Okay, so now I'm going to go on to the ears. They look very good shape for the size of your head. They're not too big, not too small. They're the same color as the rest of your face. There's no discharge coming out of them. They are symmetrical with your face. I'm going to touch your auricle and your tragus, and you're going to have to tell me if it's tender, okay?
Nope. Nope.
Okay.
Nope.
Good. Good. Okay. So now I'm going to do a whisper test. I'm going to whisper 3 words in one ear, and you have to repeat them back.
Monday, Tuesday, Wednesday.
Yeah.
Thursday, Friday, Saturday.
Good job. Okay, so now I'm going to look at your sinuses. They don't look inflamed to me. They don't look swollen. Your nose is the same color as the rest of your face. There's no discharge or secretions. There's no redness. So now I'm just going to touch your frontal and maxilla sinuses. Okay? Is that tender?
Nope.
Is that tender?
No.
Good job. Okay, so now I need to see your mouth. I'm going to assess your lips. They look pink and hydrated. Now can you smile for me and show your gums? Good. Your gums are nice and pink, no swelling. your teeth are where they should be. They're nice and symmetrical, and I don't see any rotten decay or anything abnormal with them. Okay, so I need to see your tongue now. Good. It looks nice and pink and hydrated, no swelling. Now I need to see your hard and your soft palate. Good. Your soft palate, your hard palate looks well hydrated, pink and no lesions. And now your soft palate. Good. Looks pink with no lesions and nice and hydrated. Okay, so now I'm going to do cranial nerve 9 test, where you're going to need to open your mouth and say ah. Okay?
Ah.
Good, good. And now can you say light, tight, dynamite?
Light, tight, dynamite.
Good. That's for cranial nerve 12. So before I go to your neck, I'm going to take your carotid pulses, and I need to see if they are symmetrical with each other, okay?
Cool.
Okay, so I got 31 beats per 30 seconds, so that's 62 beats per minute. They were both symmetrical, good grading, good strength, and they're nice and strong, okay?
Mm-hmm.
And that's what we wanted here. So now your neck. I'm going to be inspecting it for color, which is good for the rest, like it's matching the rest of your body. There are no scars, no lesions that I see. Your trachea is in proper alignment where it should be. I'm going to palpate your thyroid. Good. There is obvious, not swelling of the thyroid, but I can palpate it easy. Your neck is symmetrical with the rest of your body. The temperature is good, and there are no masses or lesions on it. Okay, so now I'm going to do another cranial nerve test. It's cranial nerve 11. I'm going to put my hand on your face for bringing pressure, and you're going to have to move against it.
Sure.
Good. Good. And I'm going to do the same for your shoulders. I'm going to put pressure on them, and you're going to try and need to shrug upward. Good, good. Okay. So now I'm going to be inspecting your arms. Perfect, just so I can see them. So I'm inspecting for color, lesions, if they're symmetrical, any involuntary movements. Your color is perfect. It's in sync with the rest of your body. I see no lesions. I see no involuntary movements. Okay, so now I'm going to go ahead and palpate. Okay, so I'm palpating for temperature, texture, edema, and moisture. Moisture is present, so Olivia obviously uses moisturizer, which is good for the skin. Temperature is normal. Texture is smooth. I don't feel any swelling or edema. Okay, so now I am going to take your radial pulses, okay? So I got the same. I got 62 beats per minute, which is normal. They were equal bilaterally, and they had a grade level 2+ strength. Okay. So now I'm going to assess your nails. They look nice and pink, no lesions. Okay. Now I'm going to get you to do some exercises for your arms. Okay. Mm-hmm. So can you flex your wrists for me? Extend them. Now flex your fingers. Extend your fingers. Flex your arms, extend your arms, bring your arms away, bring your arm back, and on the other side. Good. Now shrug your shoulders. Now bring your arms in a circle, and the other way. Good. So it looks like you have good range of motion. Was there any pain while you were doing that?
Nope.
No? Did you hear any cracking?
No.
No? Okay, perfect. So that's what we want to assess for, because all the movements were symmetrical. That's what we want to see. Okay, so now your legs. I'm just going to pull up your pants as far as I can see, but it looks like the skin is the same color as the rest of the body. Good. Yeah, that's okay. I don't want you cutting off circulation. They look symmetrical. I don't see any involuntary movements. And if there are any lesions, I might see some up here, but I don't see any. So now I'm going to go ahead and palpate, okay? Now you're going to have to tell me if anywhere I touch is tender, okay? Anywhere is tender?
Nope.
No? Okay, perfect. So the parts of your skin I did feel, the temperature was good, the texture was good, and I'm very surprised because lots of girls have dry skin on your ankles, but you take good care of yourself. There was no swelling, no edema, and there is no lesions. Okay, so now I'm going to have to take your pulses in your feet.
Sure.
Okay? That was easy. Okay. So I'm going to take your dorsal pedis and your posterior tibialis pulses, and I'm just going to put them up here, see if they're equal. Good, I got 62 beats per minute, and they were symmetrical bilaterally. And I'm going to take these pulses. Okay, good. So I got the same number, and they were equal bilaterally, and they had level 2 grade strength. They were a bit slower, but that's okay. That's normal for the feet. Okay, now I'm going to put your socks back on. No problem. Okay, so now I'm going to do another test. I'm going to put some pressure on your feet. Sorry, and you're going to have to try and push down on them, okay?
Sure.
Good, good, good. Perfect. Okay, so now I'm going to need to look at your back to do some assessments and to look at your breathing.
Sure.
Okay?
I'll just turn around.
Okay. So I'm just going to lift your shirt here. Okay, so what I see, there are no lesions, there are no masses, no scarring, no lumps, no bumps. There is no dysregular deformities, that I see, like no skeletal deformities. There are some macules, but I've seen that throughout the rest of Olivia's body, so I think that's normal. I'm going to go ahead and palpate to see if there are any lumps. Okay. Is anywhere tender?
Nope.
Okay. I don't feel any lumps. Temperature is good. Texture is good, nice and smooth. Okay. I don't feel any swelling or edema. Okay. Good. Good, good, good. So I'm going to listen to your breath sounds now, okay?
Yep.
Okay, one deep breath in for me. Good. One deep breath out. Another. Okay, and it's going to be the last one. And that's very good. Okay. I don't hear any abnormal sounds. I heard bronchovesicular, and vesicular sounds, which just means that it goes from high pitch to low when you go down the back, okay? So now you can bring your shirt back down, and now I'm going to look at your chest to see if there are any lumps, bumps, lesions that I see. Yeah, sure. Okay, I don't see any. I see macules, but that's normal because that's in tune with the rest of your body. There are no physical deformities. You don't look like you're straining to breathe, so that's good. I don't see anything coming out, any discharge, sorry, and no moisture is present. Okay, so now I'm going to listen to your heartbeat, and I'm going to tell you the valves as I listen to them. Okay? Mm-hmm. Okay, so this is your aortic. Now your pulmonary. And now down here is your Erb's point. Okay, now I'm just going to reach under to your tricuspid. And then here where your mitral is. Okay, now I'm just going to come back up to your pulmonary and listen to your heart for 30 seconds. Okay, very good. So I got 62 beats per minute as well. Cool. I did not hear any abnormal sounds. It was a nice strong pulse throughout the whole, throughout your whole valves, and that's what we want to hear. There's also no abnormal sounds in your breathing either. I'm going to do a ratio now just to measure your abdomen to your side, okay? Cool. Okay, so 2 and 1. Good. So that's what we want. So we want to see an APT ratio of 2 to 1 because anything more than that could mean any signs of barrel chest or any signs of obesity just because you were a bit bigger here. Yeah. Okay, but there is none. So now I am going to inspect your abdomen with your permission. Sure. Yeah. Okay. Okay, perfect. If I had a drape, I would drape her probably up to here. So I am inspecting for symmetry. Everything is symmetrical. There is no lumps, lesions, scarring. There are no obvious signs of distension that I see, no masses popping out. Color is equal with the rest of the body as well as your back. Your color is equal with the rest of your body. There are some macules, but that's okay. Like I said, that's in tune with the rest that I've seen. Okay, now I'm going to go ahead and listen to your 4 quadrants, okay? Okay. Starting in her right lower quadrant. Hearing good gastric sounds, moving up to her right upper quadrant. Going to her left upper quadrant. And then left lower quadrant. Good. I heard lots of good gastric sounds. Okay, now I'm going to palpate and see if I find any masses or lesions. Okay? Mm-hmm. You're going to have to tell me if it's tender. Okay. Okay. I don't feel any tenderness. I don't feel any rigidity. Very good, very good. Okay, now because I didn't feel any tenderness, rigidity, or edema, I think you're pretty good. Mm-hmm. And I'm happy to say that you have a positive test, and I don't find anything wrong with you. Great. Okay, perfect.